In this lesson, we'll briefly review the Family PACT program and some coding rules specific to Family PACT. After completing this lesson, you'll be able to list the core services reimbursed by Family PACT, define the S-code and its sequence in your coding, describe the rule for using the Family PACT orientation code, explain how often you can use the codes applied to counseling for family planning or an STD, and describe when to use an S-code. The PACT in Family PACT stands for Planning, Access, Care, and Treatment. The program provides comprehensive family planning services to eligible low-income men and women. At this point in time, Family PACT does not cover immunizations. Nonetheless, public health clinics should become familiar with Family PACT's covered services for its clients who are also eligible for family planning. These include an array of family planning methods and contraceptives, coverage for STD prevention and treatment, reproductive health screenings, education and counseling, some limited cancer screenings, specifically Pap tests, and sterilization. Family PACT services can be found online at familypact.org. To understand the covered services, codes, and requirements for Family PACT, you'll want to refer to Family PACT's benefit grid. A copy is available on the familypact.org website. If you need help in finding the benefit grid on Family PACT's website, you can download the job aid Finding the Family PACT Benefit Grid at your convenience. Family PACT uses a unique primary diagnosis code known as the S-code. Being primary means it's always the first code you use. The S-code corresponds to the specific family planning method the client is using. Many procedures are included under the S-code, as well as certain lab services. Certain services beyond family planning require a secondary diagnosis code due to medical necessity. To learn more, consult the downloadable job aid mentioned previously, Finding the Family PACT Benefit Grid, for more details. Family PACT recognizes counseling and education for family planning and STD services as a reimbursable service. Coding requires you to be specific about the nature of the counseling or education situation. There's a unique code assigned for a Family PACT orientation. It's Z9751. This allows you extra time to explain Family PACT services to a first-time patient. You don't have to memorize the code, but you should keep in mind that the Family PACT orientation code may be used only once per patient per group practice as an addition to the office visit. Family PACT offers additional educational and counseling to patients on topics related to preventing or treating sexually transmitted diseases or family planning options. Depending on the time spent, the code will vary from Z9752 to 54. Program rules limit education and counseling to 2 sessions per month per provider. The familypact.org website has great resources to help you learn about their coding rules. The Family PACT program has 2 unique rules when it comes to time-based coding. First, they allow an expanded definition of which providers can deliver counseling and care coordination. These may include medical assistants, public health aides, and health educators, among others. Second, to qualify for time-based coding, Family PACT requires that the face-to-face encounter includes more than 50% of the total time spent on counseling and/or education. However, there's an important Family PACT rule you should know about that can make this standard easier to reach. Family PACT allows you to cumulatively add up the time every member of your service team spent delivering counseling services. Even 5 and 10-minute increments by an aide can be added up, so long as they are properly documented. For more information about Family PACT, visit the familypact.org website. This concludes our lesson. Now please follow the instructions to take the quiz for this lesson. It'll look familiar. It's the same one you took before viewing the lesson. This time you'll be able to see the correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.